Are you struggling with ventricular tachycardia? Well, guess what? This video is going to make it so simple for you. So, hi, I am the nurse doc tutor Asia, and my job is to help you pass nursing school. Yes, you can pass nursing school. So, guess what? Don't gatekeep. Share me with your friends so you can all pass nursing school together. So, like I said, today's lesson will be on ventricular tachycardia. Let's get started. So first I want to go over a EKG wave to let you know how it's supposed to look and what it actually means. So our P wave shows atrial depolarization. So that means that the atrium contracts, and when the atrium contracts, it then pushes the blood to the ventricles. All right, so then we have our QR complex, and that shows ventricle depolarization. So that's when the ventricles are contracting, and once the ventricles contract, it pushes blood to your lungs and your body. Then you have your ST segment, and this is a pause between contraction and recovery. The heart muscle is starting to recover right here. And then your T wave shows ventricular repolarization, and this is where the ventricles are resetting and getting ready for the next beat. So before we go into abnormalities, we need to know what it should look like and what is the role of each thing, whether it be the P wave, the QRS, or the T wave, or the ST segment. So, what is ventricular tachycardia? So first we want to look at the name, ventricular. So ventricular means that the issue is with the ventricles, right? So what is the job of the ventricles? So the job of the ventricles is to contract and then to push out the blood to the lungs and the rest of the body. And what does tachycardia mean? That means fast, like a fast heart rhythm, right? So ventricular tachycardia is a life-threatening arrhythmia that starts in the ventricles. The ventricles beat very fast, usually at a rate of 200 to 250 beats per minute, and then they're often wide and regular. So this can occur with a pulse, which could be stable or unstable, or this can occur with no pulse, which is cardiac arrest. So how do you recognize VTAC on a EKG strip? So you're going to see that your patient is going to have wide QRS complexes. So these things look like tombstones, right? That is one way to remember them. They look like tombstones. Also, you're not going to be able to see visible P waves in here, right? You can't see any P waves here. And then as we look at our QR complexes, they are regular rhythm. So the patient's heart rate could be between 100 to 250 beats per minute. But you see that the patient has those wide QRS complexes, and the patient does not have any visible P waves. So we have some types of tachycardia. So you can have VTAC with a pulse. So this may be stable or unstable, and we'll talk about that. And is this an emergency? Yes. Now you can have pulseless VTACs, and that means that the patient is not breathing, the patient doesn't have a pulse, and this is an emergency. Yes, because this is cardiac arrest. And then we have Torsades de Pointes, where we have a polymorphic VTAC, which is a twisting of your QRS, and this is an emergency as well. So we're going to go into details of these three types of VTAC. All right, so first, before we go into the different types of VTACs, we're going to talk about our causes. So some causes could be MIs, stimulants, congested heart failure, acid-base imbalances, electrolyte issues, repolarization problems, electrical shock, or drug overdose. So let's talk about now stable VTAC. So if a patient has a pulse, what you're going to do is you're going to assess their vitals, their level of consciousness, and if they have chest pain. If they are proven to be stable, we want to call the provider, or we want to call the rapid response team, and we want to make sure that we have the patient on a 12-lead EKG. We want to get their labs, and we're going to administer antiarrhythmics medications such as lidocaine or amiodarone. So this is stable VTAC if the patient actually has a pulse, okay? So now let's talk about unstable VTAC. So this patient still has a pulse, okay? But if they're unstable, they're going to have a low blood pressure, chest pain, or altered level of consciousness. Now, what are we going to do if a patient is experiencing low blood pressure, chest pain, and altered level of consciousness, and they still have a pulse? We're going to prepare to do synchronized cardioversion. So what is synchronized cardioversion? That is where we put the pads on the patient, and we actually give the patient a shock to try to restore normal rhythm. And they may sedate that patient if time permits, okay? So remember, with unstable VTAC, we are going to give them synchronized cardioversion. Now, remember that even though it's unstable, the patient still has a pulse, okay? So please remember, the only reason why we're doing cardioversion is because the patient has a pulse, okay? And we're just trying to restore normal rhythm. So now let's talk about pulseless VTAC. So what are you going to do if a patient is in pulseless VTAC? So that means that the patient doesn't have a pulse and the patient is not breathing. So first we're going to start CPR, and we're going to start CPR, and we want to make sure that we call a code, and then we're going to defibrillate once the AED gets there, and then we're going to continue to do CPR. We're going to give epinephrine, and then we're going to consider amiodarone after your second shot. But for your exams, it's important to know that pulseless VTAC is treated just like ventricular fibrillation. That's the key, y'all. Pulseless VTAC is treated like ventricular fibrillation. So just how you would treat ventricular fibrillation is how you would treat pulseless VTAC. Why? Because the patient doesn't have a pulse and they're not breathing, okay? So it is so important to know that defibrillation is the only way to help this patient. But until that AED gets there, we're going to do high quality CPR, okay? So let's talk about Torsades D points. I think that this one is just so fun to look at it. So what are you going to do if you see this on your patient's monitor? So the first thing that you're going to do, your first treatment is going to be IV magnesium sulfate. So you can give 1 to 2 grams IV push over 15 minutes, even if the patient's magnesium is in normal levels, okay? So remember that you're going to need a physician order for all this stuff. Now, magnesium sulfate, that is going to help our patient with Torsades D points. Now, if the patient is unstable or if the patient is pulseless, we're going to start immediate defibrillation, and we're going to start CPR on that patient, and we're going to continue to give them IV magnesium during their resuscitation, okay? If the patient has a pulse, but they are symptomatic, we're going to continue to give the IV magnesium sulfate. We're going to correct their electrolyte imbalances. We may need to replace their potassium is low if the potassium is low, and then we may need to stop any QT prolonging medications. So it is so important to know that there are basically different ways that we can see Torsades D points. So we can see Torsades where the patient is actually unstable, where the patient doesn't have a pulse. And if the patient is experiencing Torsades D points with no pulse, then we're going to defibrillate that patient, okay? Defibrillation is important. All right, we're going to do CPR until the defibrillation comes, and we're going to continue to do CPR in between defibrillation, okay? But we're going to make sure that we continue the magnesium. So that's the difference between with the Torsades D points, is that we are now including magnesium in the mix. Now, if the patient has a pulse, okay, we basically going to try to figure out what is causing this arrhythmia, and then we want to stop the medications if they're on any medications, and then we want to make sure that we are that we may need to check their potassium. If their potassium is low, we may need to replace that, or any other electrolytes, we want to replace that, and then we want to administer the IV magnesium. So that is Torsades D points, okay? But Torsades D points is still ventricular tachycardia, okay? Whew. So we have learned a lot. So we have come to the end. So now let's put what you learned into practice. A nurse is caring for a client who reports heart palpitations. A ECG confirms the client is experiencing ventricular tachycardia. The nurse should anticipate the need for taking which of the following action? 1. Defibrillation. 2. Elective cardioversion. 3. CPR. Or 4. Radiofrequency catheter ablation. So I'm going to give you some time to think about it. So, if you chose 2, elective cardioversion, then you are correct. So, when the patient is awake and responsive, ventricular tachycardia may not be an immediate threat to the client, but it requires intervention to prevent long-term cardiac impairment or from ventricular tachycardia actually turning into VFib, right? So, we want to make sure that we cardiovert that patient, okay? And cardioversion, all cardioversion is going to do is try to restore that patient to a normal rhythm. A nurse is reviewing medication orders for 4 patients. Which patient is at the highest risk for developing torsades de pointes? Is it A, patient on metoprolol and furosemide with a potassium level of 4.2? B, a patient on amiodarone and Cipro with a magnesium level of 1.1. C, a patient on lisinopril and aspirin with a potassium level of 4.6. Or D, a patient on heparin and Protonix with a magnesium level of 1.8. So I'm going to give you some time to think about this one. If you chose B, a patient on amiodarone and ciprofloxacin with a magnesium level of 1.1, then you are correct. So that patient magnesium is low, which is going to put that patient at a risk for torsades de pointes. So I hope you guys got this one correct. A patient suddenly develops a wide complex tachycardia at 180 beats per minute on the cardiac monitor. The client is awake, diaphoretic, and reports chest pain. Blood pressure is 90/48, and the pulse is rapid but palpable. What is the nurse's priority action? Is it A, administer amiodarone 150 mg IV, B, prepare for immediate synchronized cardioversion, C, start chest compressions and call it cold, or D, apply oxygen and monitor the rhythm? So, if you chose B, prepare that patient for cardioversion, then you are correct. So, this patient is experiencing unstable VTAC. So, remember, this patient is awake and they have a pulse. So, that's why we're going to do cardioversion with them. I hope you got this one correct. And just like that, the lesson is over with. So I hope that you have learned a lot from this video. So share it with your classmates, and I will see you guys in the next lesson. Thanks for watching.